Hello. In our two-part video series, we will be discussing telemedicine and remote patient care. In part 1, we will start with the basics. First, what is telemedicine and how does it work? Second, what are the types of telemedicine and what are its benefits? Finally, how is telemedicine used today and what are its disadvantages? Stay tuned.
What is telemedicine? Telemedicine can be defined as the use of technology, computers, video, phone and messaging, by medical professional to diagnose and treat patients in a remote location. Modern technology has enabled doctors to consult patients by using HIPAA-compliant video conferencing tools. Depending on what your doctor offers, you can get medical services in different ways. Two of the most common are: 1. A patient portal. With the security of a username and password, a patient portal lets you send and get emails from your doctor or nurse, ask for prescription refills, and set up appointments. Your doctor can also share your lab or imaging test results and tell you what they mean. This is often faster than waiting to talk to them on the phone. 2. Virtual appointments. Some doctors can let you have an appointment through a phone call or video conference. You can often have these meetings with mental and behavioral health professionals and urgent care clinics, as well.
What are the types of telemedicine services? Did you know that there are different types of telemedicine? That's right, there are a few different ways that healthcare systems can use telemedicine to assist patients. Some of them are: interactive medicine, also known as live telemedicine, allows patients and physicians to communicate in real time. Communication methods include both phone consultations and video conferences. Physicians can assess a patient's medical history, perform psychiatric evaluations, and more, using interactive medicine. Store and forward. This type of telemedicine allows providers to share patient information with a practitioner in another location. For example, a primary care physician can now share patient records and medical data with a specialist without being in the same room. Systems can transmit information across vast distances and different systems so one physician can know what another has already done. This leads to less duplicate testing and fewer instances of poor medication management. Remote patient monitoring permits providers to monitor their patients in their own homes. Using patient portals, a physician can gather and share information with their patient. Besides, medical devices can send vital signs and more to providers so they can adjust the care as needed. Benefits of telemedicine. Advanced healthcare system facilities are using technologies that come integrated with telemedicine software like electronic medical records, AI diagnosis, and medical streaming devices to assist providers in diagnosis and treatment. Providers can also benefit from increased revenue. By utilizing telemedicine, physicians can see more patients without the need to hire more staff or increase office space. Also, patients can enjoy less time away from work, no travel expenses or time, privacy, and no exposure to other potentially contagious patients.
Thanks to telemedicine, patients who once could not see a physician due to access to care issues, can now do so almost seamlessly. Here are a few examples of how it is used today. With high-tech medical devices, physicians can now monitor their patients' health over long distances. Touchscreen technology allows providers to access heart rate, blood pressure, glucose levels and more, through the transmission of data from one device to another. Providers and other healthcare professionals can use telemedicine technology to monitor when and if their patients took their medicine. As a result, this leads to fewer hospital readmissions and enhances medication compliance. Emergency room is one of the most expensive, overcrowded, and stressful environments in healthcare. With telemedicine, overcrowded emergency rooms can be reduced by having patients see a remote physician using video chat first. The remote physician can determine if that individual should seek care in an emergency department, which increases efficiency. When a disaster occurs, the local healthcare resources are immediately pulled in to provide both emergent and non-emergent care. This usually results in a shortage as the demand for services is much higher than what can be supplied. With telemedicine, physicians in other locations can provide assistance by conducting video visits. Although telemedicine brings with it many benefits, there are some downsides to it as well. Providers, payers, and policymakers alike know that there are some gray areas that are difficult to keep up with. While the field will grow exponentially over the next decade, it will bring with it both practical and technological challenges. Because technology is growing at such a fast pace, it's been difficult for policymakers to keep up with the industry. There is great uncertainty regarding matters like reimbursement policies, privacy protection, and healthcare laws. Several physicians and patients are finding it difficult to adapt to telemedicine, especially older adults. Physicians are very concerned about patient mismanagement. There is also the potential for error as technology cannot always capture what the human touch can. Telemedicine solutions require a lot of time and money. Implementing a new system requires training and sometimes staff members find it difficult to welcome this change. Practice managers, nurses, physicians, and more have to learn how to utilize the system so that practices can see the benefits. This concludes part 1 of this video series. In part 2, we will look at how COVID-19 has increased the demand for these services and how they could be implemented in a developing country, Nicaragua. See you next time.